Okay, like I said, this is all casual, so since I never got to be the head of the class, I am tonight. I am Beth Morrow, and I am the respiratory therapist here at Jefferson County Hospital. I've been here almost 7 years, so I know some of you guys from meetings before or visiting our patients or even been a patient yourself. So kind of getting to know people and recognizing faces and how everybody's interrelated around here. So they asked me to talk tonight to get people ready for the respiratory season and try to head off some of this stuff at the path, before you get it. And it's kind of funny because I have been seeing pneumonia all over for the last 6 weeks. I'm just kind of being, we're having a lot of pneumonia patients. I don't know exactly what's going on. We're seeing a lot of pneumonia. So we're just going to go through the, I always try to find you some up-to-date handouts. And the pink handout here on the front talks about the pneumococcal vaccine, which is the pneumonia vaccine. It talks more about the children here, but basically what goes for the kids goes for us adults also. And I'm sure most of you have grandchildren and great-grandchildren, so maybe you can kind of promote that they get the pneumonia vaccine also, because it can hurt them. It kind of gives you what the pneumonia vaccine actually prevents. It's called pneumococcal, which is a specific bacteria, and it's one of the more major bacterias that cause pneumonia. There's lots of things that cause pneumonia. There's viruses and bacteria and funguses and stuff like that. But the pneumococcal pneumoniae bacteria is one of the biggest causes. It's out there in the community. It's something that's out there all the time. And so now they have a vaccination against it. And I wanted to clarify that because I have so many people say to me, well, I had the pneumonia shot, how can I have pneumonia? Well, that's why I want to tell you there's different kinds of pneumonia. Just because you have the pneumonia shot does not mean you're never going to get pneumonia, because it's for a specific type of bacteria. Okay? So at least this one we can prevent. And just kind of go from there. The problem with especially the Streptococcus pneumonia is it goes into meningitis, especially into children, and that's not a good thing. We've all known somebody who's had meningitis and has had problems afterwards or passed away from it. So at least we have antibiotics now. Once we get the people diagnosed, and we can, help you out. And that's why there's different types of antibiotics. And, we all go to the doctor and you get your antibiotics, or you had a loved one that went to the doctor and got their antibiotics and go, well, how come they gave me this antibiotic but you got that antibiotic? Because there's different kinds of pneumonia, so there's different antibiotics for the particular kind of pneumonia that your physician thinks that you have. And that's why it's different. And when you fail as an outpatient on like the pills, like the antibiotic pills, that's usually when you get to come stay with me in the hospital for a week or 10 days and have IV antibiotics because it's stronger. And the other thing that happens with pneumonia is, you can get the blood infection. It's called, septicemia, or the blood poisoning is a word, they used to use years ago, but it's basically the bacteria gets in the bloodstream. And, then if the bacteria's in the bloodstream, you're really pretty sick, but it can start as a pneumonia, and then as you get sicker, go into the bloodstream. And everybody who comes into the hospital, we test them for that, whether you come through the emergency room or you're sent over from your doctor's office. One of the blood tests that we do when you first get here, it is for that, to see if you have bacteria in your blood, see if you have the septicemia or the blood poisoning, because that will make a difference in the antibiotic that your physician chooses to treat you with, maybe how much of the antibiotic or even how often you get it a day. And it also will make a difference in how long you have to stay here. Somebody who has the bacteria in their blood is usually going to be here at least 7 to 10 days on IV antibiotics, where we see a lot of people with pneumonia that are here just 3 days. So that'll make a difference in the length of the course to get everything cleared up. Now, a virus, if you have a viral pneumonia, antibiotics do not work on viruses. So with a virus, all we can do is what's called supportive care, meaning we support you while the virus runs its course, and you basically get better on your own. And what we can do for supportive care is we can give you oxygen, because you're breathing hard and you're not able to get enough oxygen from your lungs to your blood. We can give you IV hydration, the sugar water or the salt water, because when you're sick and you're coughing, you don't eat as well and you don't drink as well, and some people come in dehydrated. We don't want you to get dehydrated. Sometimes people with heart disease have other things that go wrong because their body's stressed from the pneumonia, so we can deal if anything goes wrong, or if you're retaining fluid, they give you Lasix or the fluid pill so that you get rid of the extra fluid and that kind of stuff. That, and of course breathing treatments, whether they're every 4 hours or just 4 times a day, depending on how sick you are. So for a viral pneumonia, there's really not much we can do but supportive care, because it doesn't respond to a bacteria. A fungal pneumonia, we all know what funguses are. They grow on mushrooms and whatever. They're fairly rare, but we do see them once in a while. People have been cleaning out the corn crib, and you get that fungus that grows on the old moldy corn. Fungus is from mold. So we do see people once in a while that have a fungus pneumonia, and there is IV medicine that we can give you to take care of the fungus pneumonia. And those usually aren't older people. If you're usually, we see these big old strapping farmers come here just sicker than a dog, and you ask them, what'd you do last week? Oh, I cleaned out the corn crib. Oh, and that usually hits pretty fast when you have a fungal pneumonia. Those people are getting sick like within 24 hours of exposure to the mold, and they are sick. They are like dropped to their knees, sick with fevers and coughing and can't breathe. It really takes them quite fast, where a lot of your bacterial and viral pneumonias, how when you get a cold, it's okay, it kind of creeps up on you. But a fungal pneumonia, it just hits you right away, sometime within hours of their exposure. So the important thing is to get your pneumonia shot if you have not had one. If you're over 65, which I think most of you are, I'm not going to say you all are, but if you have any underlying health condition, you don't even have to be 65. So if you have any type of lung disease or heart disease, cancer, diabetes, any other kind of underlying health care, so with your family members, they can have a pneumonia shot. They're recommending now, and you can see on the front page, that babies get vaccination when they get their normal baby shots. They've put that in there with the normal baby shots at 2 months and 4 months and 6 months and a year.
How often should you get one?
They say every 5 to 10 years. So, and that is a question if you come in the hospital that we are tracking now. We ask you, when was your last pneumonia shot? And if you're due, you're probably going to get one before you leave. That's kind of the new Medicare standard, and it's something that Medicare has us track. In fact, every 3 months I take everybody who's been seen in the hospital with pneumonia, and I have to go to a Medicare website and put in your name and your social security number and all the stuff about you, and that you're in the hospital and what antibiotic we gave you, and if you're current on your pneumonia shot and if you're current on your flu shot. And that's something that the federal government is tracking for every hospital, not just ours, but they're tracking all of us. And it's just it's called a standard of care, you know, and it's prevents people from becoming ill and getting sicker, and people unfortunately die from pneumonia. And so if it's something we can prevent, we would like to do that.
Your doctor would have a record of when you got your pneumonia.
Yeah, but unfortunately, when you come in at 2 in the morning, you know, he's not over there to answer the phone and tell us if you've had your pneumonia shot. So it's usually taken care of before you leave the hospital. It's not the first thing we do, because it's not going to make any bit of difference when you first show up. But it's something that we do before you leave. And we see people who do not we do have people who do not have a family physician, or, you know, they've moved here to be by the kids, you know, so we don't have access to their physician nor their physician's records. So it's something, you know, how if you've been through cardiac rehab or pulmonary rehab or the diabetes group, how we always tell you should have this little card with all your medicines on it that's current. You know, to me, that's something you could add to that little card, because then you'd always know when your last pneumonia shot was. You know, so if you got it like in a 5-year thing, you could think of, you know, 2000, 2005, 2010. It's easy to remember, but of course this is 2006, so that kind of shoots that in the. But you know, my whole family's had their pneumonia shots, much to their dismay. I drug them, you know, all when they first came out, and make them keep current, and you know, they're strapping high school and college kids, but I don't really care. And a lot of that is because the colleges are now requiring that kids had meningitis shots and pneumonia shots if they're going to live in the dorm, because there's so many kids, you know, smashed into small places, and you know, they eat after each other and drink after each other, and gosh only knows what else that I'm sure I don't want to know about, you know, and those communities, you know, trade germs a lot, just like people who live in the nursing homes. You cannot live in a nursing home unless you've had a pneumonia shot. It's it's kind of like, because they're in such close contact all the time, and you know, once it gets started in those environments, it just can, you know, go like fire, you know, down the rest of the residents. And hand washing and controlling your respiratory secretions, you know, is the best way to not share with people or have them share with you. And so they're doing a lot better in the school systems. I've noticed that they have the hand sanitizer on the kids' desks now, like in the elementary and in the high school, and I was, you know, and we have them in all the patient rooms now, you know, the alcohol hand squirters, and in the dining room, and just about every place. And I noticed different places they have masks available at the doors when you go in, so people can put masks on, and not if they're coughing, but people need to control their respiratory secretions, whether it's their sneezes or their coughs or their handkerchiefs or their Kleenexes. They need to take care of that and themselves. And some people are messier than others when it comes to that. So, do we have any questions on pneumonia or the pneumonia vaccination? They say every 10 years if you're under 65 and don't have any health problems. But after 65, or if you have underlying health problems, they're saying every 5 years. So, okay, and it's just like anything else. When you first get a vaccination, it's pretty strong, and then it kind of starts, you know, slacking off. So as you get further out from your vaccination, the less protection you have, and that's why people who don't have immune problems and don't have underlying health problems, they say every 10 years, but people who have those other problems are saying every 5, because you're kind of falling off the immunity thing. Okay, the green paper is on influenza and the influenza vaccination, and this is a yearly thing, and actually it only lasts about 4 months. That's why they don't like to give it to you till the middle of October or towards the end of October, and it only lasts about 4 months. The reason it's yearly is because they change it every year. First of all, influenza is a virus. And what they do is the scientists who are in charge of making the influenza vaccine really just do an educated guess, like what flu or flus do we think are going to be the most prevalent out there this year, and they take a certain number of them, like 5 of them or 10 of them, and they combine them all into one vaccine. And so it's an educated guess. This is the kind of flu that's going to be around this year. And they track all the different kinds of flu through the years and through the cycles, and so they're pretty good at coming up with which flu is going to be out there. Obviously bird flu is not one of them, and there's no vaccine for bird flu. So they're working on it, and hopefully it'll come to pass, and we'll have a bird flu vaccine. The flu shot, besides the shot, they have that nasal spray flu vaccination. I've personally never tried it. Don't know anybody who has, but I guess you just squirt it up your nose and it's absorbed through your nose membranes. And have you tried it? She's shaking her head. Okay.
I take the shot every year.
Yeah.
It says on the nasal one between the ages of 5 and 49.
Yeah. So I think last year when they were running out, they didn't give a hoot if you were under 5 or more than 49. If they had it and they didn't have the shot, it was better than nothing. But
Expect plenty of flu shots to go around this year.
Yep, should be. It should be. In fact, last year we had extra after we got the next shipment. And there were some people that were getting 2 flu shots because it's done in about 4 months. And so some people that were really, really high risk, like heart transplant people and people with severe cases of cancer or, severely immunosuppressed from their chemo, they were revaccinating some of those people in March to take them, further into the spring. Because you see flu year round, but we see it more in the fall and winter. And it doesn't hurt. I don't think it hurts, but that's me. So the same thing is with the flu. About the flu is spread by respiratory secretions. The flu is a respiratory disease. It's the coughing, the hacking, the cold, wheezing, I can't breathe. The flu is not nausea and vomiting and having diarrhea. Even though everybody calls that the flu, that's a gastrointestinal problem. The actual influenza is a respiratory problem. And why people die from influenza is because it goes into pneumonia, and because it's a virus, all we can do is give you supportive care, and it has to run its course. There's no antibiotic for it. And that's why people die from influenza. Because it's a respiratory disease, and it's spread by coughing and sneezing and people wiping their nose and then holding the grocery cart. Then the next person comes in and lays their hand on the grocery cart handle, and there's flu virus sheds on there. Then they squeeze the cabbage, and and it's just a whole. And that's why they have those wipes at the store now.
I use them.
And that's why I just about cringe when I watch people let their kids gnaw on the grocery cart. But that's how it gets spread from person to person, and those secretions, get on tables or on doorknobs or wherever, and we pick them up. We pick them up shaking hands at church, and all those things that we do with our life. So you just got to kind of, the only way to prevent it is wash your hands, and don't lick the sick guy, I guess. That's what I always tell my kids. And I'm going to tell you a story about the flu shot, because sometimes I always think, oh yeah, the flu shot, right? My dad always said, I've never been so sick in my life as when I got a flu shot. How many times do I hear that? I hear it all the time. Okay, I have a son who says the same thing. I'm too big and tough. The flu can't bother me. Okay, we're talking 14-year-old, 6'2", 180-pound monster child, all right? He could eat a hog and still be hungry in one setting, okay? We all had flu shots at our house last year, but him, because he knows more than his mother, okay? So I get called in January from the school. He's not at school. Oh, wonder why. I was at work. I thought he was going to school. So I get a hold of my husband. Oh yeah, he didn't feel good this morning, so I told him he could stay home. Okay. I get home from work. This kid has like 104.5 temperature. I mean, he is sick. Sick. Okay, fine. He got the flu. Drink some 7-Up, drink some chicken broth. Next day, he's still sick. And he's a wheezing and he can hardly breathe, I think, I said, okay, well, I got to go to work, Drink some 7-Up, drink some broth, you'll be fine, take Tylenol. The next day, this kid still has 104 point something temperature. Well, I decided I should be concerned. I said, okay, 3 days from this big strapping kid, who's looking a little gaunt. So I take him to the doctor. They do this nose swab thing, is how they actually find out if you have influenza. And they, put it on this little paper, and it takes 15 minutes to turn colors, and if it turns purple, you have influenza. Okay. So they do the little nose thing, and they wipe it on the little paper, and before the nurse even walks out the door, it is like purple. And she goes, oh my gosh, they're all running around, putting masks on, So this kid had the full-blown influenza. They wouldn't even let us go out the door. They made me take the car to the back door of the clinic and pick him up. They wouldn't even let him walk through the waiting room to leave. So they gave him the Tamiflu, because if you start the Tamiflu within 72 hours of onset, it will help kill the virus in your body, and it makes the disease last half as long, is what they say. So we went to the drugstore, got the Tamiflu, and the physician we saw put my other child that lived at home on Tamiflu just as a precaution, even though he'd had the flu shot. But he has underlying heart disease, and that's all he would need would be, it was so funny because the doctor says, we don't see him very often, do we? Because his chart's about this big. I said, nope, football physical every year, that's about it. He says, yep, we haven't seen him since he had his baby shots except for 2 football physicals. So the kid never gets sick and never goes to the doctor. And he was deathly sick for 6 days. I've never smelt something so bad in my life as that child, even though, he'd still, and he ran a fever that long. And then when it finally broke, I didn't think I was ever going to fill him up. Because when he finally decided to eat, and he lost like 12 pounds in 6 days. He, perspired and wasn't taking in enough. And, he was just about ready to get stuck in the hospital for a little IV hydration, but he finally turned the corner. So, and the rest of us didn't get sick. And we all had the flu shot. So, it was obviously in my house, And 14-year-old boys, they walk around, even though you tell them, cover your mouth, don't come near us, you try to quarantine him in the room, we were probably all exposed before he got sick from him anyway. So, it made me a huge believer that, and the type of flu he had was covered in last year's flu shot. Because they call it, like influenza A and influenza B and influenza, So it really, it made me this huge believer. So anyway, it has at the bottom of the page, it tells you about who should get vaccinated, and this stuff I got off, this is this year's guidelines from the Center for Disease Control. If you're allergic to eggs, you shouldn't have the regular vaccine. I do believe they have another type of vaccine that is for people who are allergic to eggs, but the one that they give to everybody at the flu shots at the Hy-Vee and the Walmart and the churches that they set them up all over. It's because they make it out of the egg yolks. They grow the viruses on eggs, and then they kill them, and then they put them in the flu shots. So that's why if you're allergic to eggs, the big problem with that. And then, some people do, you get maybe a little bit of a sore arm, or you maybe feel a little yucky for a day or two, but it's nothing compared to having the actual influenza. I always tell people to get your flu shot in your dominant arm, because the more you work it out of the muscle, the quicker the soreness goes away. So if you're right-handed, get your flu shot in your right arm. Or you can get it in your rump. But if you have really skinny arms, like the babies, they usually give it to them in their rump, because they usually have pretty skinny arms. Okay, so we hit those two things. So that my big thing to talk about was secondhand smoke, and it's the big thing in the news is secondhand smoke. And Christopher Reeve's wife just, died of lung cancer at, what was she, 41 or 43 or something, and from diagnosis to when she passed away was 10 months or 9 months, and she had all the specialists in the world and all the up-to-date chemos, and it didn't do a thing for her, and she still passed away. So I decided I'd look up more about secondhand smoke, since it's the big buzz, and kind of educate you guys on secondhand smoke, because we're all exposed to secondhand smoke, whether we like it or not. Whether it's in our homes or in the coffee shops or where we go. And gosh, I really found this very interesting, and what it does to kids. And I see a lot of people with asthma and people with respiratory problems, and they wheeze and carry on. And I knew in my head that if there's a smoker in the family, whenever I have a kid in the hospital with pneumonia or asthma, one of the first things I ask, is there somebody who smokes in the house? And there's always at least one parent. Always. In my 20-some years of doing respiratory therapy, I've had one child in the hospital with a pneumonia that did not have a smoking parent in the house, and that child had heart disease. So he had another problem. But when I started thinking about it, and going back and thinking, there's always somebody who smoked in the house. And so it really does set these kids up to be sicker. And so I thought, so when I started reading this, I was really shocked, because I didn't know all this stuff. There's 4,000 chemicals in secondhand smoke that we're breathing. 4,000. Formaldehyde, they embalm bodies with formaldehyde, and formaldehyde is in secondhand smoke, and we breathe that in our lungs.
Our furniture has it too.
Mm-hmm. Yeah, but it's not.
What do you do about that?
It's not out here in the air.
No, but your clothes is laying next to it.
Well, and the other thing that on one of these pages I found really interesting is actually the secondhand smoker is getting more chemicals than the smoker. You're getting twice as much as the smoker. And that it stays in the room for hours, even though you can't see the smoke, it's still in the air, and you're still breathing it. So even though the smoker has gone away, or you've fanned it out of the room or whatever, it's still in our air. It comes through the ventilation systems, through the air conditioners, through your heating systems. So somebody standing outside smoking is wonderful instead of smoking in the house, but if they're standing next to the air intake of the air conditioner, it's still sucking it into your house. And this happened at the University of Iowa. There was a big hubbub up there. What happened was they had no smoking in the hospital, so all these people were running out to different places to smoke outside. And I don't how they have all those parking ramps up there. Well, on the north end, it's parking ramp 1. There's just a little alley between the hospital and parking ramp 1, and all these people were congregating out there smoking. And there's like a big steam register thing, like outlet, like in the sidewalk, because the boilers or something must be under there. So a lot of people stood there in the winter and smoked because it was warm. Well, what was happening is, and they couldn't figure out because they monitored the air at this clinic on the inside, it was the pediatric chemotherapy unit. And they couldn't figure out how they were getting all this smoke and all this stuff in the air in their pediatric chemotherapy and radiation unit. And when they finally figured it out, it was being sucked in through these heat things in the sidewalk from the smokers standing out there smoking. And it was, coming in and going through the whole system and being dumped into where those kids were coming for their chemo and their radiation therapy for their leukemias and their, whatever their cancer problem was. So there was a big hullabaloo up there about that. So, isn't that, that's just amazing. So, so for secondhand smoke, it sets you up for, obviously lung cancer. 3,000 people a year die of lung cancer, and they got it from secondhand smoke, whether it was their spouse smoked or their mother smoked, or they sat in an office next to people who smoked, that kind of thing. You are more prone to sinus problems from secondhand smoke. You can have all these sinus infections. Some people get sinus cancers, that kind of thing. Cervical cancer and breast cancer and ovarian cancer. So now who's going to get that? It's all of us ladies out there, are more prone to have those 3 kinds of cancers just from secondhand smoke. And the other one is bladder cancer, and when you think about, your tissues and how everything, when you breathe in the secondhand smoke, it, goes through your lungs and into your blood, and it, goes to all those places. It also sets people up for heart disease and emphysema. I've seen people with terrible emphysema that's never smoked a cigarette in their life, but their spouse might have smoked or something like that. So it's kind of a sad, and we're just learning all this so that it's not to lay blame, on people from years past, because they didn't know. And, we're just now learning all this about secondhand smoke. And that's why everybody's in an uproar about making all the restaurants smoke-free and the school grounds are smoke-free. And, our hospital went completely smoke-free this year. And, the employees aren't allowed to smoke while they're here. They're not even allowed to smoke in our parking lot. And, some people weren't very happy. And it's to protect everybody else that they're around. And, if people choose to smoke, that's their right, but it's not their right to affect the people around them. And so that's why all this stuff is in the news, and all these places are going smoke-free, and you have people that are not very happy, but that's why. And little children can't protect themselves against an adult. And most schools, I think, are completely smoke-free right down to the athletic grounds. You can't smoke at the football games or the track meets or the, softball and baseball games and that kind of stuff. It's all completely smoke-free. So, and that's why. And I put the risk of secondhand smoke down here to a child, and some of it has to do with smoking mothers. Mothers who choose to smoke while they're expecting their babies at risk for being born premature and having a low birth weight, more so than a lady who doesn't smoke. Sudden infant death syndrome, or crib death as it used to be called, actually your child is 4 times more likely to die of SIDS or crib death if there's a smoker in the house. And I think that's pretty significant. That would scare the heck out of me. Okay, asthma. They're saying that 200,000 to 1 million kids a year are affected by asthma that's caused by secondhand smoke. So these kids wouldn't have asthma or wouldn't have asthma problems if they didn't have a smoker in their house. And that's pretty significant. That's a lot of kids, and people die from asthma. Asthma can become a lifelong disease, and asthma is expensive, and asthma medicine's expensive. So when you think that what that does to our healthcare system, that somebody has to pay for those doctor bills, whether they have private insurance or they have state insurance or whatever, those kids have to go to the doctor, have to go to an emergency room, and have to have breathing treatments, and all the stuff that goes with asthma. Somebody has to pay for that. So whether it's our taxes that are paying for it, or our Blue Cross premiums go up, because we have to pay for it, but it has to be paid for somehow. And so, that's just a huge, huge amount of money and a huge bunch of lives that could be affected just by those kids not being exposed to secondhand smoke. And the ramifications are so far-reaching because those kids miss more school, and have more problems in school because they're not in school, or they don't feel well while they're at school, so they don't learn as well. So it's a whole lifelong, problem for them if you can't learn because you can't breathe, or you can't go to school because you can't breathe. So, and air pollution does the same thing. It doesn't have to be just cigarette smoke, but there is air pollution smoke, and the bigger cities have a tough time with. They actually have, in large cities, actually have asthma clinics right in the schools, so they can keep the kids in school and give them their breathing treatments and all the stuff they need, so they can keep them in school and keep them learning, or they'd never be there. These kids would never learn. And that's too bad, because I'm sure that a lot of them have a lot of potential. Also, kids that grow up with are more likely to have dental problems, and I found that really interesting. Their enamel isn't as good on their teeth, and so they're more prone to cavities and dental problems if they live with a smoker. And dental care is not cheap either, and it's not fun for the kids to have to go through that. And for all of us, they're more prone to ear infections, and we've all know kids that have horrible, how painful that is for them, with their ear infections. And so they're more prone to ear infections. They say 700,000 to 1.6 million ear infections a year are blamed on secondhand smoke. And that usually involves at least one doctor's visit or emergency room visit and some antibiotics. So that's a costly thing that could be prevented, and where funds could be saved, and a lot of, unnecessary pain and stuff for the child and for the parent. If you've ever been a parent walking the floor with a screaming kid with an earache, it's not a good time. And I'm sure we've all been there with that. But the secondhand smoke, that it can affect the heart, which is probably what most of you guys are interested in. They estimate 35,000 to 62,000 people die a year from heart disease that was caused from secondhand smoke. That's a lot of people. What is that, the size of Iowa City? Probably 62,000 people. I think there's something like that. I think that's a huge amount of people, just because they were exposed to secondhand smoke throughout their life, and it's affected their heart. Okay, we'll flip the old page here. Okay, and it's okay. Now we all have, you guys have probably, especially if you have heart disease, have had, these are the carotid arteries here on the sides of our neck that take the blood up to our brains. And those arteries also get hardening of the arteries, like you hear about, and then you don't get enough blood flow to your brain, and then people get confused, or they get dizzy or whatever. Well, secondhand smoke is linked to those arteries hardening, and then you don't get the right blood flow. So that's another thing. And obviously the hardening of the arteries of the heart, but it does the same thing. And believe it or not, it doubles your risk of having a heart attack. Secondhand smoke, if you're exposed to secondhand smoke, it doubles your risk of having a heart attack. And I think that's pretty significant, to me. So, I wish I would have printed off the thing that had all the chemicals that were included in secondhand smoke. It was just totally blew my mind. I didn't know what some of them were, but I just thought it was unbelievable. The next page I had for you, also in yellow, was, it actually came from the state of Utah, because they passed a secondhand smoke law for the whole state. But it kind of tells you how it travels through the heating and air conditioning, and and it can get through little cracks, and how long it can stay in your house or your room, after somebody's been in there that has smoked. Has anybody gone like to a motel room and the minute you open the door it just kind of hits you in the face? Oh gosh, somebody smoked in here or something like that. I think we've all experienced that because it kind of clings, the smell kind of clings to things, and it kind of gets in cracks and stuff. So it's hard to clean up after because it's there. So this just kind of gave, the reason I picked this because I liked the little chart that just kind of had everything there, that how secondhand smoke can give you the throat infections and the asthma and the lung cancer and the heart disease. And impaired lung function basically means emphysema or chronic bronchitis. The itchy, watery eyes, which I'm sure we've all experienced if you've been someplace that's, I always call the room, if the room's blue with smoke. We've all probably experienced that. If people who get other infections like colds or just other illnesses, it takes longer for them to heal and get over it when they're exposed to secondhand smoke. So that's another consideration if you've had some type of surgery or you have some other kind of health problem that went wrong. And I like the one, it increases allergies, but I also like the other one. It says noxious odors, and in parentheses it says it just plain stinks. I thought that was kind of a cute thing. So then on my last page, I just gave you a little cartoon because you're supposed to end with something kind of funny, and it shows this little bear. It's kind of hard to see because I had to blow it up. It shows this little bear in a room with a bunch of big bears smoking, and they're coughing, and then it says eye irritation and nose and throat discomfort and blood pressure problems, and it increases your carbon monoxide level in your blood, and your heartbeat increases. And then the second thing, it shows the little guy running out of the smoke out of the doorway, and then in the third little frame it shows him outside talking to his little friend, and the little friend saying, "Ooh, where have you been? You smell awful." And that is the first thing we notice, isn't it? Is we smell it on somebody, or we smell it in a room where there's been smoking, or we smell it on ourselves when we've come out of someplace where we've been exposed in a restaurant or someplace where they have smoking. So these restaurants, talking about restaurants, that have gone completely smoke-free, well, good for them, but you still have all these restaurants out there that when you go in the door they say, do you want smoking or non-smoking? So we all say non-smoking, right, because we're all going to be healthy here with our hearts. And so we go over here to the right, and 3 feet away is the smoking section. So are we really in a non-smoking section? The answer is no, because we just talked about the heating system and the ventilation system, and I'm sure they don't have 2 different ones, especially in these smaller restaurants. And so the blue side of the room over here that's enjoying their cigarettes, it's still being circulated through the whole room and through all the heating and air conditioning ducts and being blown out on us and our family on the other side. And even those little, some places now have the little screen up, so you can't see anybody smoking, basically, is what it comes down to. But you're getting just as much in those areas. So, but I think most restaurants are to the point where everybody's smoke-free. Airlines are all now smoke-free. I don't think there's any airlines or airports that you're allowed to smoke in. Last week Monday I was in Iowa City with my son for an appointment, and it was kind of funny because when we went into the parking ramp, there's this, about this tall concrete retaining wall. And there, honest to God, was 6 people lined up on this retaining wall just a-smoking to beat the band. I mean, they were just a-smoking. And they had on, hospital scrubs. They were nurses or surgical technicians or physicians, for all I know, just smoking to beat the band. And there was I call it a pickle bucket, the white buckets that pickles come in or something for restaurants, and it had big sign on it, put butts here. And it's sitting there on this retaining wall. So I thought, gosh, I thought they were smoke-free up here. So I went, we went to did our doctor's appointment. Well, now when you go into the university, they give you this piece of paper that says, the University of Iowa Hospitals and Clinics is smoke-free, and it shows you the campus, and it has this dotted line that says, within this dotted line, there's no smoking. This retaining wall is 1 foot out of the dotted line, okay? And it's like, so here's the hospital, and then here's this ramp, and there's this retaining wall, and then right here is what they call the field house, which is where the college kids go to exercise. It has all their running tracks and weight machines and all this kind of stuff in it. And the door is like right by, you have to go past this retaining wall to get into one of the doors into the field house for these kids. And they're sitting like from me to you smoking, and so when they were opening this door, all this smoke was being blown into the field house. So now I just read in the paper, I don't know if it was Monday night or Tuesday, that the University of Iowa now, they had to go make some rule or law that you can't smoke within 25 feet of a door. Did you read that? Of the door to their buildings. And that was why, because they had to figure out a way to get these people from sitting on the retaining wall and smoking. So that was what was, I just thought that was hilarious. Because they were all wind up out there. Just like, so. Any questions I can help you with, or comments, or?
You see these places where you put your cigarettes in